Sioux Falls health officials stressed one word today when it comes to getting a vaccine: patience.
They also warned that while hospitalizations and new case numbers are stable, you still can't let your guard down.
We need to just continue to stress the patience in terms of when the vaccine will be available and when people will be able to get that much coveted poke in their arm.
If you're curious about when the vaccine will be made available to you, the mayor says the best source is covid.sd.gov. It has county-by-county information on vaccinations, as well as when they will be available and who is eligible. You can find a link on kelloland.com. In some cases, the hospitals will reach out to you if you're signed up for their online programs, such as Avera Chart or Sanford's MyChart.
There will be information coming as to where, what, when in regard to vaccine.
KELOLAND News will also be a source of this type of information.
We want to get vaccine in people's arms just as quickly as possible, and every last dose we get in, we'll get in there just as quickly as we can, but just have some patience and grace with us.
Dr. David Basil believes the AstraZeneca and Johnson & Johnson vaccines should be approved for emergency use sometime in February or March, and that will mean a large number of people will be vaccinated once they arrive in South Dakota. So far, we haven't seen a Christmas surge, and case numbers appear to be flattening out. Doctors from both hospitals believe there is a simple reason for this.
I think we've seen a definite change in the public's behavior versus, say, October and November. You know, the number of mask usage. We pleaded with people to change their Thanksgiving plans from what's traditional, and anecdotally, I think people really took that to heart.
Other parts of the country are surging now, and they hope South Dakota can avoid getting caught up in the rising numbers. The vaccinations, combined with the fact that about an eighth of the population of South Dakota has already had the virus, could help.
The hope would be that if it did come back, it's not going to spread as rapidly, but that's simply my hope and a somewhat educated guess. But there is concern that this thing could keep coming around. And so thus also my call is not only thanks to everyone, but stay vigilant with what's going on right now.
So far, a more contagious variant of the coronavirus hasn't been detected in South Dakota, but that's probably because we haven't been testing for it. That special genomic testing will be ramping up soon by Avera. Doctors say the good news is it appears the current vaccines do protect against the more contagious variant. Now, you may have a lot of questions about the coronavirus vaccine. Coming up in a special Health Beat edition of Inside KELOLAND, we'll be talking with Monument and Avera about how the vaccine rollout is going across KELOLAND. But first, we need your questions. If you have questions about the vaccine and we would like doctors to answer it, you can fill out a form on KELOLAND.com, then watch Inside KELOLAND on Sunday, January 17th, after the late local news, or on Monday, January 18th at 6:30 p.m. Central Time.